Post-op dental care. So again, post-op care after your dental implant surgery, the all-on-4, all-on-5, all-on-6, whatever it is you're having, this is the post-op care for that. As prescribed by my dentist, and that is Dr. Christian Yaste at Valentine Dentistry. So, you know, they really talk about the oral hygiene, how important it is and how critical it is for the success of your implant procedure. That being said, you're going to be really, really careful post-op the first couple of weeks, rinsing them out. Again, I went over earlier, but using this product until it's completely gone. And this is used 3 times per day. This is an oral care recovery kit. So if you can see that, that was given to me by my dental practice during my pre-op appointment. So using that, irrigating, but we're not going to use the irrigation. We're not using this product, an irrigation product or a water pick, until the doctor says it's okay. And that's going to be 2 to 4 weeks after the procedure. So we won't use that until then, but we will use the other kit and make sure that our mouth is cleansed really well, and we take care of that. Should be minimal bleeding to be expected after the procedure. Best way to stop that is obviously dental gauze. Listen, if you are having this procedure done, that means that you have had multiple other dental procedures done prior to getting to this point. So this is no surprise for anyone. You know, we just want to make sure that we're not bleeding for days and days and days. If so, contact your doctor's office and talk to them about that. Swelling is completely normal, especially, you know, 2 to 24 hours after surgery, and then up to 3 days after surgery. It should reach the peak around that time. It's going to depend on each person how much they swell. So I may not swell hardly at all. It may be minimal. Somebody else may be extreme. Be careful about what you're doing, because that's going to definitely affect how much you do swell. So don't be leaning over a lot. Don't go outside and do your gardening, you know, the day after surgery. If you do that, you're going to swell, and it's going to be extreme. So everybody's going to be a little bit different on that. The bruising, again, case by case. I might have 2 black eyes. Somebody else may have nothing. So it's just, you know, depends on the person. Applying ice packs are going to help that. 20 minutes on, 20 minutes off. You know, the old, it's not really a wives' tale. I don't know what you call it, but, you know, placing the bags of peas or, you know, frozen peas on your face, or frozen veggies. That's going to help. Then you just throw it back in the freezer again. Let it get firm, put it back on, or any type of ice pack will do. Medication and pain, again, you know, it's pain management, whether or not you need a narcotic for that, or Advil, Tylenol, some sort of ibuprofen, Motrin, that sort of thing, if that works for you. Maybe you use a narcotic, and then you know, and then in between using the narcotic, you use the ibuprofen. That works too. Alternating, maybe use the narcotic for the first day or 2, and then wean off of that onto an ibuprofen thereafter. Just making sure that you do not take any of that if you are taking something like a blood thinner, like a Plavix or a Coumadin, because that will affect that. Your diet post-surgery. Liquids. So start off with liquids. See how it goes from there. You are going to be restricted to a soft chew diet for a long period of time. I was a bit surprised. I thought maybe 4 weeks for like a real soft liquid, soft food diet. My surgeon says 12 weeks. That is 12 full weeks. 4, 8, 12. Well, 3 months. I was a little shocked, I guess. I don't know why, but I was a little surprised by that. Hold 1 second here. Okay. Sorry about that. At any rate, listen, I'm not a professional, okay? So when I see something come in on my phone, then it takes my attention. Okay, so